Chalmers University of Technology. In Gothenburg, Sweden, the Chalmers University of Technology is an institute that pushes for solutions to important societal challenges every day, test new ideas, and contribute to the development of a sustainable future. Researchers at Chalmers gained worldwide attention for mind-controlled arm prostheses. This year, 2024, the research center was shut down. Now, a Swedish newspaper, DN, reveals that research was conducted on humans without proper permits, potentially involving over 100 individuals. In the spring 2024, Chalmers suspended all operations at the research platform Center for Bionics and Pain Research, CBPR. The researchers had received international acclaim for groundbreaking work on prostheses, especially arms and hands. However, Chalmers' Ethics and Misconduct Committee uncovered several deficiencies. The most serious issue was research conducted without sufficient permits, according to Petter Falkman, professor and head of the Department of Electrical Engineering at Chalmers. "You're not allowed to do anything without a permit. It's as simple as that," he said at the time. A few months later, CBPR was shut down entirely. Research on minors without authorization. The newspaper, DN, reports that Chalmers' internal investigation revealed researchers tested a technical solution for pain relief and rehabilitation on a minor patient without authorization from the Swedish Medical Products Agency. This could constitute a legal violation punishable by fines or up to 2 years in prison, DN writes. The newspaper's investigation also traced at least 15 similar unauthorized studies involving over 100 participants. Chalmers' Ethics Committee also pointed out that the research center selectively reported data and participants to make treatments appear more effective, according to DN. "I treated 4 or 5 patients, but we only included the one who improved in the study," a former researcher at the center told the newspaper. Former director calls it a witch hunt. Serious deficiencies in the workplace environment and leadership were also identified, including threatening messages from the center's former director to employees. The former director denies accusations of misconduct and unauthorized experiments, describing Chalmers' criticism as a witch hunt. "Studies conducted without permits represent a very small portion of CBPR's research," the former director claims. He described the device used in the studies as non-invasive, posing no risks to participants, and used only in isolated cases. Chalmers has reported the research center to the Swedish Medical Products Agency and the Appeal Board for Research Misconduct. Patients left in limbo. Many patients who benefited from the program are now left without support. Ulf's frustration with Chalmers, no help for his robotic arm. When the acclaimed research center behind Chalmers' robotic arms shut down earlier this year, patients relying on mind-controlled prostheses faced difficulties. Adjustments they depended on could no longer be made. Ulf Karlsson is one such affected individual. After losing his right arm in a workplace accident as a young man, Ulf eventually received a mind-controlled robotic arm in 2016 through CBPR. The prosthesis restored his sense of normalcy, allowing him to perform intricate tasks like picking up papers, moving raw eggs without breaking them, and carrying water-filled glasses confidently. However, since the center closed, Ulf's arm has lost much of its functionality. "Now my arm only works at 10% capacity," he says. "It's like being in a vacuum, with zero communication from Chalmers." Ragna Emardson, head of Chalmers' Department of Electrical Engineering, states that patient support now falls under the public healthcare system. "Patient contact should and must occur within standard healthcare," he says, noting that Chalmers has no responsibility once a study concludes. The prostheses are not commercially available products, meaning patients must rely on public health care, with possible technical support from Chalmers. Sahlgrenska University Hospital, a partner in CBPR, confirms it is the go-to point for patients with prosthesis issues. "We're considering how to help them within the bounds of laws and regulations," says Martin Bystrom, acting head of hand surgery at Sahlgrenska. Sahlgrenska's next steps include ensuring compliance with regulatory standards for any adjustments or replacements to the prostheses. Meanwhile, the Swedish Medical Products Agency has launched a new investigation into CBPR's clinical trials. What do you think? Should rules always be followed? Despite its non-compliance, CBPR's research helped people. What are your thoughts? Should all rules and regulations always be followed, or should there be flexibility in groundbreaking research? What risks arise if researchers and companies operate unchecked? We look forward to hearing your thoughts.